Hello, everyone. My name is Joshua Delgado. This is my evidence-based practice virtual poster on increasing successful quit attempts in adults who smoke through nurse-led interventions. Smoking is one of the leading preventable causes of chronic disease and death in the United States. Many patients receive minimal counseling in the clinical setting, missing opportunities to improve long-term health outcomes. This goal aligns with the Healthy People Objective 2030 TU-14 to increase successful quit attempts among adults who smoke. Nurses have an opportunity to address this problem due to their frequent patient interactions and ability to provide education, support, and follow-up. My PCOT question was, for patients 18 years or older who smoke, how would further counseling, medications, or insurance coverage led by nurses, compared to standard care, increase successful quit attempts within 6 months? This question guided my entire portfolio project to measure outcomes and conduct accurate research. The evidence strongly supports nurse-led smoking cessation interventions. First, a study by Brandt et al. Shows that a staff-led intervention improved patient engagement. Readiness to quit assessments increased from 8.1% to 31.8%. There was an approximately 20-fold increase in referrals in cessation services, and about 37% of patients set a quit date, which is a key step in successful cessation. A qualitative study by Hassan et al. Identified important barriers such as time constraints, lack of training, and limited resources. Structured symptoms and organizational support were discovered to significantly improve smoking cessation interventions' success. Zhang et al. Conducted a scoping review that confirmed nurses play a central role in smoking cessation care. Their ability to lead these interventions is backed by their experience already as educators, facilitators, and coordinators. Rigatti et al. Found that hospitals can be a teachable moment, but following up after discharge is essential for improving long-term quit outcomes. Finally, Zhang et al. Conducted a network meta-analysis discovering that counseling with pharmacotherapy is the most effective approach and that nurse-led interventions significantly improve quit success rate. Overall, the evidence supports a structured, nurse-led, and multimodal approach to smoking cessation. Based on this evidence, I am proposing a standardized nurse-led smoking cessation policy requiring all adults patients who smoke to receive tobacco use screening, structured counseling using the 5As, access to pharmacotherapy or referrals, assistance with insurance or access barriers, and follow-up for up to 6 months. This change replaces inconsistent standard care with a structured, evidence-based approach to ensure all patients receive the same level of support. To implement this policy, I would use the Iowa model of evidence-based practice. I would identify the clinical problem and review the evidence. A pilot program would then be implemented on one unit to test feasibility. Nurses would be trained on the 5As counseling method and pharmacotherapy options. Electronic health record prompts would be used to standardize documentation and ensure consistency. Early adopters would be champions to help support the adoption of this intervention across the organization. After evaluation, the intervention could then be expanded hospital-wide. To evaluate the effectiveness of this intervention, several outcomes will be measured. These outcomes directly align with my PCOT question and determine patient outcomes and sustainability in practice. These would be successful quit attempts within 6 months, patient readiness to quit, referral rates to cessation services, follow-up compliance, and smoking-related readmissions. Implementing a standardized nurse-led smoking cessation intervention can significantly improve patient outcomes This strengthens the nurse's prevention and chronic disease management roles, promotes health equity by improving access to resources, and enhances continuity of care through structured follow-up. It aligns with national health goals and demonstrates how evidence-based practice can be transformed into clinical improvements. Thank you for watching my project. Congratulations to all my colleagues this course. Take care.